The Fulton-DeKalb Hospital Authority, celebrating our past, present, future. Past. Henry Grady was known as the spokesman for the New South. He was a vocal member of the Atlanta Ring of Democratic political leaders and used that position to leverage his influence in business and politics. Grady Memorial Hospital, known as Grady Health System, was named after Henry W. Grady because he was the first to advocate for a public hospital in Atlanta. Grady Memorial Hospital opened its doors June 2, 1892, and was the first public hospital in Atlanta. Grady opened with 4 doctors, a matron known as a Grady doctor's wife, 12 male and female nurses, and 18 other employees, including cooks and engineers. The hospital wards were divided by gender and race. For pay patients had private rooms. The hospital had 110 beds, and 50 of those were for blacks. In light of Jim Crow in the 1900s, they provided a separate hospital structure according to race. The Butler Hall unit was for whites, and the Grady's was for blacks. In 1941, the Fulton-DeKalb Hospital Authority became the owner of Grady Memorial Hospital. In accordance with the Georgia Hospital Authorities Law, the Board of Commissioners of Fulton County and DeKalb County adopted resolutions establishing the Fulton-DeKalb Hospital Authority. From 1941 through 2008, the FDHA owned and operated the hospital facility known as Grady Memorial Hospital, which was expanded over the years to include additional clinical and other facilities. Together with GMH, are collectively referred to as Grady Health System.
The FDHA plays such a critical role because they own the asset of Grady Hospital and serve as part of the governance structure for this hospital.
The Fulton-DeKalb Hospital Authority is needed particularly to interface with the DeKalb County government and the Fulton County Commissioners to remind them that their support is vital, not as a gift, Grady, but to help pay for the care of citizens of Fulton and DeKalb who cannot afford their own doctors, who otherwise would not have adequate medical care.
Fulton-DeKalb Hospital Authority kept Grady Hospital alive for a very long time. Then its leadership had the courage to create this new entity, which now manages the hospital and has grown the hospital substantially.
When we first looked at the hospital, it was in the bottom quartile of any performance measure we could find. Never in my wildest dreams did I dream that it could become the very best in certain categories.
The hospital now has an array of services that are first class. And the fact that this is a safety net hospital for our region, it is in a tremendously better shape than it was 7 or 8 years ago.
Without Grady, our healthcare delivery system in Atlanta just doesn't work. We don't have the capability, we don't have the wherewithal, we don't have the beds and the operating trauma and ER capability to manage our population without Grady Hospital.
Grady is a reflection of the community we live in. Its diversity, the excellence of its medical team, with Morehouse and Emory doctors staffing it. Moving forward is to look at how we can improve the health of our entire population in Metro Atlanta.
And I think the community ought to be very proud of Grady. It is now not an institution in trouble, but a first-class healthcare institution serving the citizens of really North Georgia.
Grady has a tremendous impact on this city and this region. It is the place that we all want to be in case of any traumatic issue that happens to any of us.
It is fulfilling its mission. I don't think that could have happened without Fulton-DeKalb Hospital Authority's both its attitude, its courage, its bravery, and its commitment to serving the citizens of its community.
The Fulton-DeKalb Hospital Authority, celebrating our past, present, future. Past. In the midst of intense scrutiny in 1984, a new 30-year contract approved with Fulton and DeKalb counties to provide medical care to their indigent sick, and the Sickle Cell Center opened. The Infectious Disease Center opened in 1986. The authority acquired Crestview Nursing Facility, the largest nursing home in the state with 388 licensed beds, and finalized a major comprehensive contract with Morehouse School of Medicine in 1991. Hugh Spalding Children's Hospital became a freestanding hospital in 1992. In 1994, Lindbergh Women's and Children's and the North DeKalb Health Centers are established. Volunteer corporate and civic leaders G. Lemuel Hughes, Ann Kramer, Robert L. Brown, and Veronica Biggins established the Henry W. Grady Foundation to raise additional funds for Grady Health System and Boat Rock Women's Health Center, the first medical center to open inside a public housing complex. In 1996, the authority celebrated 50 years of managing Grady, dedicated its clinic and diagnostic center in honor of Grace Hamilton Holmes, former authority trustee and civic leader. It is further noted that in 2001, a gift from Jane Fonda and matching philanthropic funds raised by Grady Health Foundation renovates the Teen Services Program, and the Grady Cancer Center was established with support from the Avon Foundation and the Georgia Tobacco Settlement Fund. In 2008, local classical architecture enthusiasts partnered to restore the Goddard Memorial Chapel at Grady, and the authority leases Grady Health System to the newly formed Grady Memorial Hospital Corporation. In 2012, the authority hosts its annual health summit to shed a light on and provide solutions, as well as a dialogue about timely important health issues impacting residents in Fulton and DeKalb counties. In 2014, the authority introduces the Network of Care for Public Health, a groundbreaking tool that surveys all population health statistics in order to present a comprehensive and continuously maintained dashboard of all local health indicators.
As we matriculated and stayed up front of all the healthcare issues, it became a visionary hospital, visionary by two counties primarily, Fulton County and DeKalb County, that saw fit for its people that could not afford health care to be treated like people who had money to pay for the health care services. Grady required funding that was needed. If you needed a PET scan, that was expensive. So the equipment, the type of staff, and the expansion, there was no money to fund it. So in 2008, the authority decided we need to reach out to the business community, and that business community heard us, and that started the revitalization of this hospital.
The community had not been engaged from a business point of view in Grady in nearly 30 years, and a hospital could not sustain itself without the community being involved, especially the business community. The chair asked me to take the lead on this transition. First, it was an honor, but we both knew it would be extremely difficult. A lot of political pushback would occur, racial problems, racial questions, economic interest. But our goal from the start was to take care of the patients and to make sure that the people were taken care of. And as long as we started with that, then the endpoint would be well worth the problems that we would face along the way.
Throughout the transition, Frank Monteith and myself, along with Michael Hollis, both individuals are no longer with us, but Frank's ability to stay calm no matter what, he never missed a meeting, and no matter what was going on, he was there. He did not mind working with the physician committees. He was what I call the hero of the three of us working.
So Michael's role was to chair the Financial and Investment Committee. Michael, again, is an Atlanta native and also a Grady baby. So it's something that was very dear to his heart to make sure that the committee itself was on the right track and it was reaching its goals and objectives.
We talked to politicians, not just state and local, but we talked to those who were from Washington to get advice. We talked to congressmen and former congressmen. We talked to former healthcare professionals in the administrations of both the Republican Party as well as the Democratic Party. We needed input, advice on how do we move this process forward in order to save the hospital. And the fact is, Atlanta, we cannot live without Grady Hospital. And I'm happy that I was a part of saving it.
And the FDHA will have that awareness in the community. It will continue to grow, and I'm sure the board and trustees and all those surrounding the program itself will continue to allow Grady to succeed as time goes forward.
The Fulton-DeKalb Hospital Authority, celebrating our past, present, future. present. Today, Grady is one of the largest health systems in the world. It is the 5th largest hospital in the United States. Grady is considered one of the premier public hospitals in the southern U.S. The hospital is known for training some of the best health professionals throughout the country. Emory and Morehouse Schools of Medicine provide residents with training at the hospital, and many practice at Grady after their residency.
I'm thrilled when I drive around and I see the billboards that show people who have gone to Grady have had their lives saved by being at Grady, and on a billboard, and you see people from all colors, all socioeconomic spectrums, male and female, that all will attest to the fact that Grady is an asset of the community and not just necessarily something there for poor people.
Its transformation in 2007 and 2008 put it on a path of not only sustainability, but to be a leading innovator in the healthcare arena.
We have the best and the brightest here, and it makes it so much more enjoyable to be working with the highest quality professionals. We're an organization where young doctors want to come and practice. They want to come and learn. Same with our nurses. They come here because they know that the training and experience that they're going to get is above anything that they will get anyplace else.
Grady Health System means so much to the Atlanta community and is really making its mark nationally and internationally. Grady is well poised since its transformation to not only be a leading, but the leading national public health system in the country.
The Fulton-DeKalb Hospital Authority, celebrating our past, present, future. The rich history of the Fulton-DeKalb Hospital Authority that began in 1941 when Grady Hospital claimed that there must be equality for treating the residents of Atlanta, Georgia, and Fulton County. Today, the FDHA continues to work closely with Fulton and DeKalb counties to discharge its statutory responsibility under HOW to address the unmet healthcare needs of the counties, and has established innovative and much-needed educational, research, networking, financial support, and preventative health programs to augment the healthcare services provided by the GHS in order to fulfill the healthcare needs of various populations within the counties. As the Fulton-DeKalb Hospital Authority accomplished 75 years of existence, we humbly salute as well as honor those individuals that have weathered the storms to get us where we are today. We say thank you to all of you. So tonight, as the Authority celebrate our 75th anniversary, we will host its 5th annual Health Summit, building healthy communities, one step at a time.
Grady Hospital throughout the years has been consistent in terms of providing quality services. I personally have used Grady Hospital for my primary care as well as my family, and I found the customer service to be excellent and the medical care to be superb. And so I strongly encourage others to utilize the hospital as their primary home for their medical services.
Grady is all about the community, building partnerships that's going to last for a long time. The Fulton-DeKalb Hospital Authority is really the convener and the catalyst for making these things happen. So I'm excited about the future. I'm excited about what it's going to do in metropolitan Atlanta, but it's all about making people well.
Fulton-DeKalb Hospital Authority is a great asset to this community, not only because it helps to oversee and manage the hospital itself and its various aspects, but it also has been a great corporate partner in DeKalb County specifically in its education of the community in terms of health and wellness. They have helped to support so many programs and events, educational opportunities to help people see how they can make their lives much better in terms of their health.
I want to offer my heartfelt congratulations to the Fulton-DeKalb Hospital Authority and the Grady Memorial Hospital System for their great service to our community over the past 75 years.
Not only are we celebrating 75 years, but we're celebrating the future of what the Fulton-DeKalb Hospital Authority has in store that would ultimately benefit the hospital itself, but more importantly, the people of our region.